We like to explain things to our patients so that, and many leave the appointment saying that was very informative and eye-opening, because we think that it's important to take charge of your health and responsibility. And here at the practice, as well as prioritizing the diagnosis and the early diagnosis, we also prioritize being proactive rather than reactive. So being reactive to a problem is what happens very often in dentistry, where you just turn up to the dentist when you have pain or when you've broken something. We like to preempt those problems and do early diagnosis and say, well, this is basically your menu of issues. This is a priority because it's going to give you an active infection very soon. Let's take care of that first. And then these are things that you can think about and are more elective, and just inform the patient so that they can make good choices themselves.
And I think the other side of education is just really understanding how important the diagnosis is. Everything is about diagnosis. So
Yes.
you need the right diagnosis, and then married to that is the right treatment plan. In terms of education at home, it's really educating people to understand just what you can do with prevention. You know, most oral disease is fully preventable if you pick up the right hygiene habits at home and the right maintenance routine, coming to seeing a hygienist. If you have gum disease, in our opinion, you should be under the care of a periodontist. I think that's really key. And you know, once you're here in these four walls, we'll do our best to educate you so you feel empowered to make the right choices for your own healthcare. I think that's the second side of the education piece, is what happens in here. For me, I want people to feel confident with their intuition and challenge clinicians if they don't quite agree with what's being told to them, and seek a second opinion. I think it's important for patients who have gum problems to seek out and find a periodontist, to seek the right treatment for that, for whatever diagnosis they have. And really, we're trying to create as much material and for patients to help them make choices that are in their interest.